Welcome to Clinical Conversations, Communication and Flexibility with Temporary Roles. This webinar is part of a new series of conversations with clinical specialists. My name is Caleb Schwinn, and I'm a registered nurse with experience in critical care and healthcare informatics. With Mobile Heartbeat, I work as a senior implementation consultant, working with customers to develop best practices and optimize clinical workflows using MHCure. In this webinar today, we'll discuss how clinicians who need to assume a temporary role, otherwise known as a dynamic role, can be easily contacted by colleagues without them needing to know details like their name or their phone number. We'll begin with a brief video that outlines the functionality of the dynamic role feature. After that, we'll dive into real-world applications and the impact that can have on a facility.
Dynamic roles allows you to assign yourself to a temporary role in addition to your primary role and receive all calls and messages on the same platform, eliminating the need for additional pagers and devices to support temporary roles. Log into MHCure and select Dynamic Roles on your dashboard. Browse the list of dynamic roles and select the role you'd like to opt into. Tap the toggle button and select Confirm Dynamic Role. You'll now receive all your calls and messages in one place for both roles. Access dynamic roles on both hospital-owned or personal smartphones. You'll keep the role until you opt out or another colleague assumes it when they begin their shift. When you need to reach a particular role, but you aren't sure who is currently in the role, search by dynamic role within the directory. You can favorite the dynamic role for quick access in the future. Hospital admins can create as many dynamic roles as necessary, such as charge nurse, on-call cardiologist, on-call neurologist, and more. Additionally, admins can configure the dynamic role so that if no one picks up, it will auto-forward to a unit desk phone or the number of their choice. Dynamic roles provide flexible role coverage options and makes it easier to connect with the right people quickly.
One thing any acute care clinician will tell you is that patient care is a team effort. Going through nursing school and clinicals, I tried to learn as much as I possibly could to be able to effectively care for people. But I quickly realized that, knowing my resources and how to access them was almost more important than my depth of clinical knowledge. Being able to quickly identify and communicate with a specific person within a facility has historically been a pain point at almost every healthcare organization I've ever worked at as a nurse. I remember rigging up little badge-sized cheat sheets with frequently called numbers, laminating them and just kind of rigging them to my badge for easy access. Sometimes there would be some kind of directory printed out at the nurse's station, usually with numbers crossed out and new extensions written in the margins. Not only was it disorganized, but it was inefficient, to say the least. Half of the time you would just call a unit clerk or an answering service, just hoping that you would get connected with the right person. Especially when I was a travel nurse, I rarely knew the name of the person that I was trying to get a hold of, which just compounded those issues. The MHCure dynamic role feature offers a solution to that. Dynamic roles allow clinicians to assign themselves to a temporary role so that coworkers can find them quickly and easily without having to know their name. I experienced this the first time I worked in a facility with MHCure. With dynamic roles in MHCure, there's no guesswork in finding who you're looking for. So searching for a role will give you an option to text or call that person directly. There's no asking around for an extension or trying to find out who's on today. You can just contact them directly, open a line of communication, and it's that easy. It's intuitive and it just works. One of the more challenging and common healthcare communication workflows is trying to contact the on-call physician. Pager numbers, answering services, complicated rotating schedules have traditionally been the convoluted paths connecting clinicians and providers. The dynamic role feature simplifies this process for both the physician and anyone who's trying to get a hold of them. The physician simply, from their personal phone, assigns themselves to that role that they're fulfilling for on-call, and they are automatically taken out of that role when the next person takes over. Secure, HIPAA-compliant messaging is direct. The entire process for the clinical staff is consistent and easy, and when the physician is no longer on call, they're able to completely disconnect, eliminating confusion and unintended off-hours calls. Maybe one of the best things that the dynamic role feature offers a facility is the seamless flexibility in their creation. These contextual roles can be created so easily that it really allows for some truly creative communication workflows. For example, we've seen dynamic roles built solely to identify super users during a clinical tech go live so that clinicians can quickly get a hold of a subject matter expert when trying to navigate a new clinical technology for the first time. Another use case became prominent during the start of the pandemic when we saw COVID-19 specific dynamic roles deployed, such as PPE liaison and COVID coordinator, providing a direct line of communication to those individuals during a very challenging and unique time. And with this flexibility, the roles can be removed just as easily as they were created when that time eventually comes. Forget searching colleagues by name. Easily locate and direct message them by role instead. Regardless of shift changes, you'll always be able to contact the right person first. Thank you so much for watching. If you enjoyed this brief webinar, please click the link below to see more and be on the lookout for our next one coming soon.